So then let's take a look at why it's a little bit hard for hospitals to disclose these costs or give you an upfront cost. The first giant thing is insurance. There isn't one insurance company in the US. We shop around for insurance. Everyone, it seems like, has a different insurance provider. And if they do have a different insurance provider, then they at least have a different plan. So you have different insurance providers with different plans. People can be on the same type of insurance, but they can have a different plan. And there's so much plans where each patient is a different negotiation in a sense. So each patient is going to have a different cost associated to their treatment. Everybody comes in with a different plan. Everybody's a different charge, which is why it's so chaotic, because they might have an idea of how much this surgery can cost the hospital, but just because the surgery costs X amount of money, they have a contract with the insurance provider of how much they're going to be charged for that procedure. Let's just say a procedure costs $50K, but they have a contract with Blue Cross Blue Shield that, okay, it costs us $50K, but we're going to charge the insurance $80K. And then we're going to charge the patient this much based on their plan. And these negotiations are done on closed doors, so nobody knows, nobody discloses their pricing. You cannot find an accurate number of what a hospital charges themselves to do a procedure because it's done behind closed doors. People do not want this to be known. If the CEO of the hospital does not want this to be known, because there is an overcharge, because the hospital has to make money. So even though this is a nonprofit hospital, if a procedure costs you $50,000, they're probably charging insurance like $80K, $90K, $100K, depending on what they could squeeze out of them. And they don't want the public knowing, hey, this procedure technically costs us $50K, but we're overcharging you by $40K. Our price is going up 100% because we could get that out of the consumer. That's why it's so hard to figure out and keep things fairly transparent when it comes to these kind of things, because the big chunk of the negotiations are handled at closed doors around a round table that nobody besides the people in that room know. And they don't want to talk about it because it's very private, because they are making money. And people are going to get really, really upset if they find out that, hey, hospitals are charging insurance companies 100%, because I think about it. If the hospital is charging the insurance $40K more for a procedure, that insurance has to give that $90K, but who is paying for that $40K, right? The people are. We're paying for that money. We're paying for the hospital profit, but then again, the insurance also has to have a profit, right? So we're also paying for the profit for the insurance. So a procedure might cost $50K. The hospital might get paid $90K for it, but as an insurance company, you might charge $120K for it. So on top of that, the insurance is making $30K. So the hospital making $40K, the insurance is making $30K, and who's paying those people? We are, the people that are insured, the consumers, because we're you could say the bottom of the totem pole, we're where the money comes from. Without us, there is no money, so they're going to charge us as much as they can, because the insurance has to meet its quarterly revenues, has to upcharge, the hospital has to upcharge as well to stay standing, to make the next quarter revenues and be a successful business. It's also very competitive in the sense of the hospitals want to have as much patients as possible. So there has to also be a negotiation that goes on between what hospitals are going to accept what insurance. And there's a lot more hospitals than there is technically insurance providers. So the hospitals want to fight for as much patients as they can, and the insurance has to come to agreement with the hospital to then allow their insured people to come to the hospital. So that's a really big negotiation as well on how can the hospital be able to jump on the insurance's terms so that the insurance is going to approve this hospital, which then gives the hospital patients. So it's like a fine balance of how much can the hospital charge to then satisfy the insurance, so then the insurance agrees with the hospital and then sends them patients. because the hospital has to make money off the procedure, but it also needs patients. And for both those to happen, they need the insurance approval. Because if this insurance does not want to go to this hospital, well, then the hospital is going to have to find patients somewhere else. They're going to have to go to a different insurance provider. So there's a competition between the insurances to see what hospital they want to join, and there's a competition with hospitals on what insurance they want to take on. So that just makes things even more competitive. It makes things even more complicated, because without hospitals, insurance is pointless. Without insurance, hospitals don't have money and don't have patients. Hospitals also do get the Medicare, Medicaid kind of stuff, the government provided finances, but you can't just have a hospital that is going to take government money. They're going to be very limited. They need some kind of other private healthcare sector insurance providers to be able to also join that hospital. Another reason why hospital costs are regularly disclosed is because there is not a lot of consumer pressure. We are the consumers, and like I mentioned before, is we like to keep the talks about our money quiet, and we like to keep the talks about our health quiet. We don't want to talk about it. So there really is no pressure from the people to have these hospitals actually disclose these costs, because trust me, if the people put their foot down and said, hey, we want you hospitals to give us a piece of paper that says, hey, this is what we think you should do. This is what we recommend for a treatment. This is how much it's going to cost you. I guarantee you, if we, the people, said that we want that with our visit or within the first 24 hours of our visit, I guarantee you hospital will step up and they will do that for us. It might increase the costs of the administrative stuff. It might increase the costs a little bit for the consumer, because if you want this done, it has to be created, right? Not going to come out of thin air. We're going to need to pay for it. But this is going to be pennies on the dollar versus what they're overcharging us now, you could say, because now when you have like a catalog of, hey, this is what we think we have to do, this is how much it's going to cost you, so on and so forth, then you're going to be able to argue a little bit for the price. You're going to be able to haggle a little bit for the price. You're going to look at that and be like, okay, well, how about we do this, this, and this, and next time you could do this, this, and this. Maybe I'll come in for elective procedure after you discharge me to do this, and it's going to run your cost a little bit lower. So if they're able to provide you some kind of a document, some kind of a list of what they recommend and what kind of a price it's going to be attributed to each procedure, you're going to have more haggle room. You're going to be able to facilitate discussion, and pricing is not going to be any more between insurance and hospital. It's going to be literally the person to the physician, or physician to the hospital. You're going to have more say on what you want done and how much it should cost you, how much you're willing to pay, because right now the person is not in a speaking table of how much things should cost. It's only the insurance and the hospitals. And if you give the consumer, us, the people, some kind of paper that says this is what it's going to cost you, how much you charge, then we are taking some control of what we want done and how much we should be charged, because now you not only have to satisfy the insurance company, now you have to satisfy the hospital, you now have to satisfy the actual patient and the patient's family on how much you're going to charge. This gives us a little bit of a seat in this roundtable of healthcare costs decisions, but there really isn't any consumer pressure on this. So if they're not going to be pressured, they're not going to move from a status quo, because they know that if we want something like this, they have to provide it for us, because we could go to a different hospital that is going to provide it, and once you stir that pot and one hospital jumps on board, every other hospital is going to have to jump on board, and they know how much of a big chunk of money they could lose if they disclose more of their pricing or even their pricing models. The last one, why it's difficult for hospitals to give us a accurate price on procedures, is because no one is sure what that procedure is going to cost until it's actually done, because everybody's different. Sometimes you might use more stitches, you might use less stitches, you might require more nurses, the post-op care might be different, the pre-op care might be different, more surgeon might be in the room. It might have been a little bit more difficult surgery because you really don't know what you're going into until you open somebody up, technically, because you might do the scans, but when you actually go in there, you might see a whole different picture. This simple procedure might turn into a little bit more of an extensive procedure. So this is one of the, you can say, bigger reasons, more talked about reasons why hospitals can't really provide very accurate pricing, because everybody is a variable. Everybody is a variable. Everyone's health is a variable, and someone might look like an easy procedure walking in, and you never know. And plus, when it's an emergent thing, you got to have all hands on deck right away. So that's going to increase cost versus an elective thing where they can plan for it. Emergency things are always going to cost you more because we need it done now, and the only way we can get it done now is if we pay for it. Like, for example, food. You could either order Uber Eats and it's going to get delivered to you now, or you could drive around, get a restaurant, sit down, and then you could eat. You're paying Uber Eats to get you that food now, so it's always going to charge you more than if you decide to go to a restaurant and sit down and eat. It's always going to have that quick factor, that now factor, and the now factor is always going to cost you more.